Hello everyone, I'm Erica.
And I'm Akilah.
Welcome to HeartsChat.
Hello everyone, so we're back with another episode, and as usual, we're going to start with our check-in. So Akilah, would you like to go first?
Sure. Okay, so I guess really what I've been doing is kind of get back on track after the holidays, because I feel like there's just so many days off, and like I'm such a planner, so I know, okay, what I'm doing the next day, what I'm doing this, but like this time around, I just felt so like all over the place, like literally all over the place, like just because I think it's how Christmas and like New Year's Eve, how they all fell like in the beginning of the week, so it's kind of like, oh, I still have to go to work.
Yeah.
Oh, I don't like this.
Yeah.
So my schedule has kind of finally gotten back to a normal schedule where the kids are in school full time, like during the week, there's no breaks, like everything's kind of slowed down.
You know, that's nice. It's nice to have a break, because when you're working, you're like, man, I just can't wait for the next holiday, the next day off. But then you get it, you enjoy it a bit too much. You're like, oh, I have to go back.
Exactly.
And it's not the work. Honestly, it's not the work. It's just a matter of wanting to go when you want to go.
Exactly. Say it again.
Yeah.
But how are you doing, Erica? What's going on?
Good. I got to spend some time in Texas over the holidays, so just adjusting to not seeing my niece so much. It was so nice. Wasn't there very long, but all the time I was there, I was making sure to see her as much as I can, because we live in different states and everything, and trying to plan the next time the family's going to get together so we can do something. So, and I will definitely be planning that soon. When you were talking about getting back on track, I told you a bit ago, another episode, I talked about my new planner that I have on my refrigerator, it's not a whole calendar, but my agenda for the week. I actually got 2 planners for Christmas. My aunt got me one. Yeah, my aunt got me one that fits in my purse, and my mom got me a bigger one that kind of goes in the briefcase. And so I'm definitely, definitely putting both of those to use.
That sounds great.
Yeah, I hadn't even mentioned it, so definitely excited about that. So now that we're all checked in, ready to get started with our topic today?
Sounds good.
Okay, so today we are going to do a Q&A, just answering some questions we've been asked over the years about mental health. So we're going to start with the first question. We have about 10 or so questions here. So we're going to go through them, and hopefully these answers a lot of your questions about mental health and therapy. And if you have any other questions that pop up, you can always comment to us or email us, write us on Facebook, Twitter, Instagram, our YouTube, any of our outlets if you have any questions anytime about anything. So we'll go on with the first question, and that is, where can I go to find therapy?
Yes. I hear this a lot. And in terms of where to go, I feel like there's so many resources that people just don't know about. I always say if you have insurance, start with your insurance, because therapy can be somewhat pricey sometimes, depending on where you are. So I always say start with your insurance and go on their website and see what kind of therapists they have in that accept your insurance.
Yeah.
Because then you'll be paying way less than what you would have to pay without going to someone who doesn't take your insurance.
Exactly.
So that's what I would say. That's the first place you want to start.
Definitely, I agree. You can call your insurance company. They can give you a list in your area. You can also check with your primary care physician, and they could recommend you and give you a recommendation for a therapist or two, and another resource would be the internet. You can go on Psychology Today. And that's just a popular one, but there are so many other websites to find a therapist. You can get on Google and do that. You could probably go on Yelp. They have everything else. Word of mouth if you want to go
Yes.
through somebody that knows. And that can be tricky because sometimes you don't always say, hey, I go to therapy or I went to therapy. So that can be tricky sometimes. And also depending on your age. If you are in elementary school, a lot of times a counselor or a teacher, but it goes for elementary, middle school, and high school. It's pretty much the same. The guidance counselor will have some resources for you. And in college, a lot of universities have, counselors and therapists on campus that you can meet with.
Yes, exactly. And you bring up a really good point, Erica, in terms of like going to like guidance counselors. Cause I feel like, when parents need some place to go, that's a great place to start too. Like the guidance counselors and the school, because I don't necessarily know how they do it in every state, but specifically in New Jersey, since I work and know things here, like we have a whole, a system called Perform Care, which you can call up and then mobile response services, basically meaning like people will come to your home and do an assessment. And then you can see if you need like in-home services or maybe even go to outpatients. There's plenty of resources available like that. I don't know how they do it in other states, but I know that New Jersey does that. So yeah, I mean, sometimes parents, they often don't know where to turn to, or they may have exhausted all the resources. So sometimes just turning to the school guidance counselor may be helpful as well.
Exactly. So those are just some tips to start. So you can definitely start there to find a therapist. So the next question is, what are the different types of mental health professionals?
Oh, this is I feel like this list is so extensive. Like, what does that, there's a lot of us that do. At the end of the day, I feel like our goals are all the same, but just how we approach it is different. So like Erica and myself, we're marriage and family therapists. So our whole way of thinking is called like systemic. So basically we are really looking at absolutely everything, and how, like when you walk into our office, it's kind of like, okay, so let's look at everything. So let's look at family, let's look at past, let's look at work relationship, let's look at work, let's look at school, like absolutely everything to kind of see how it contributes to your current problem. So we also want to invite as many people into the room as possible. So, so that we can get like a better understanding of all dynamics, because we're very relational in the way we think. Did I cover that? All of that?
Yes, you did.
So like, try to make it as succinct as possible, but it's like, that's kind of our framework of that. So, but then you can go into like psychologists and psychiatrists and, licensed social workers, and, there's just so many.
Licensed professional counselor.
So, exactly. There's just so many different degrees that you can go for, and just basically everyone has kind of a different way of thinking about problems. That's really how I've kind of broken it down. Exactly. I don't know if you've thought of it any differently, Erica.
No, I agree. I think it's pretty much the same. It's just a matter of the school you went to, what your program was,
exactly.
And the test that you take. What test do you take for that program? It's pretty much, because sometimes you'll get people that say, I'm looking for a licensed clinical social worker. Well, we have a licensed marriage and family therapist in your area. Well, I want licensed clinical social worker. They're pretty much, like you said, have the same goal, which is a matter of how they think about it. And a lot of times people don't really know the difference. It just could be, well, I know somebody does this, or that's the kind of person I had before, so I think that's what I need, without really knowing, or they don't know that there's other types. They just know. I agree. All they know, they just, that's it. I mean, I can remember being in school, we had the guidance counselor. That's the only counselor I knew about. I didn't know there was different types of counselors. So it's just a matter of, what you're exposed to. So the next question, can people stabilize a mental illness simply with medication alone? So can I overcome this mental health issue with just medication and no therapy? I think they go hand in hand. Okay. I think if you take medication for mental health concern, you should be in therapy. And you don't have to go to therapy every week, but at least, maybe once a month for a check-in. And that being, if you already had your therapy, once a week that you did, and you take your medication and you feel like, okay, I've got my system, I've got medication, this is working for me, I've done the work in therapy, I can manage this on my own. I think that's good, but you should at least go once a month just to maintain, on track.
I can agree completely with that. Like, I think it definitely goes hand in hand, and not to say that everyone who goes to therapy will need medication.
Right.
But there are plenty of people out there, because I think about it both ways, because, I see people with and without medication. And if a person needs medication and isn't taking it, talk therapy alone doesn't work. Like, you have to be stable in a sense, which medication will do for certain people, to be able to think about being able to put in techniques and strategies to kind of go along with your medication. Like, I've had plenty of clients who kind of stop taking their medication as an experiment, which is never a good thing to do. Please do not do that. And they realize, oh, I really do need this. Or my thoughts are just going, and I can't stop them. So I agree with you completely. They have to go hand in hand.
Yeah, definitely. So to answer that, can people stabilize mental health issues simply with medication alone? No. Not gonna recommend it. No. And we can all get by, in some capacity, but you won't be at your best.
Correct.
And that's the goal. So the next question here, let's see here. This is a little bit lengthy. Let me try to shorten this up. Okay. If I go to receive a mental health service from a mental health provider, do I have to get a diagnosis, or am I going to be labeled in a certain way?
Okay.
I think
first, go ahead.
Oh, go ahead. That's a big one.
It's a big one. Because first and foremost, if you're going through your insurance, there has to be a diagnosis. Like, if we're going to talk about the business side of therapy that goes along with this, insurance companies do not reimburse or do not pay if there's no diagnosis. So there has to be a diagnosis. With that being said, and how I do therapy, I try to do based on the least, I guess, what's the best? I don't know the best way to say this. The one that wouldn't, a diagnosis that won't really follow you, unless I think that you may be suffering from something more severe, like bipolar or things like that. Then that's when I would send out to a psychiatrist to kind of evaluate that, because they are more equipped to evaluate for testings and things like that.
Right.
But other than that, I'm usually, most of my clients are at like an adjustment disorder.
Yeah.
So, which is pretty much general, like, life transition type things.
Yeah. That's basically, if you have a situation that you're coming in to work with, and you have to, if you're billing it through insurance, you have to put something.
Correct.
That's pretty much what that's about.
Yep. Exactly.
And that's with anybody who walks into the room that is, having some life stress or situational type of things that doesn't really meet the criteria for a mental illness or more, extreme mental health diagnosis. You have an adjustment disorder. It's that's going to be anybody.
Yeah, and that usually, that's a diagnosis you can only keep for like 6 months. So it's really not people who go into therapy are worried about like diagnosis following them. That's not something that would follow anyone per se.
Yeah, and therapy is also confidential, and that's one.
Exactly.
With the diagnosis, I never liked. That's the worst part for me. I
know.
I don't like to label people. And
exactly.
A lot of times it's not really the client that even ask about that. A lot of times, if the people that I've worked with, if you already have something like depression, you already know. You already
Exactly.
and diagnosed with that. And it's usually parents, that want to know or have the concern, and rightfully so, because kids are diagnosed with ADHD all the time when they don't have
Yes.
ADHD,
Preach on it.
Yeah, but I don't like labels because a lot of times it's situational.
I agree.
And people fixate so much on these labels, and it can really follow you if you let it. So, it's all about how you think about it,
I agree.
If it helps, you can think of it as, we got to put something down for, billing purposes. And, and if it is a more extreme label, another way to think about it is it's just a part of the process to helping you to, feel better, figuring out what's going on here, figuring out.
Agreed.
This is what it is. This is how we treat that. That's it.
Yes. I agree 100% because once you have the right diagnosis, it's even easier to treat.
Right.
I agree with that completely.
And also, these diagnoses, you have these categories, which means that this is something, it's not just me, but other people experience this too. Kind of gives some hope if you can think about it that way.
I agree.
Okay, everyone. So tune in next week for part 2 for our Q&A. So we're going to finish up. We have a couple more questions that we're going to answer. So tune in next week for those.
Thank you so much for listening to HeartsChat today, where we speak from the heart. We hope that you enjoyed our show. Catch us every Sunday and Tuesday at 7 p.m. Eastern Standard Time on our YouTube channel and on our website, which is HeartsChatRadioshow.com. Be sure to follow us on our social media pages at HeartsChat Radio on Instagram and at HeartsChat on Twitter, Facebook, and Periscope.
We love to hear from you. If you have any comments or questions or topics that you want to hear about, you can email us at HeartsChat@HeartsChatRadioshow.com. And for all of your personal relationship questions, please visit my blog from ericasheart.com. Thank you for listening to HeartsChat, where we speak from the heart.